When we're talking about cellulitis, we want to understand that's different than cellulite. We hear from a lot of women with questions about cellulite. For some reason, they usually cuss when they send their questions about cellulite. So cellulitis is a different situation. We do have videos on cellulite. We'll put those in the link in the description below if you want to check that out. But cellulitis is more of a skin infection. And this can really create some cussing on its own for a lot of people, because this can be a chronic or a recurring situation where a person will have a painful infection. It's usually in their legs, but it can occur in other parts of the body as well. But a lot of times this will create like open sores, and they'll have a hard time healing this infection, or the infection will come back. So in this video, I want to help you understand why this happens. The tricky part that confuses a lot of people and frustrates everyone trying to correct this issue is that the underlying mechanism that can cause this to come back again and again can be different from person to person. There's never going to be one solution that fixes this for everyone, so we end up with a lot of frustrated individuals. So today I'm going to go through the three most common underlying mechanisms that can cause this to come back again and again. I'm going to show you simple tests that you can do at home to get an idea which one of these problems could be creating trouble for you, and steps you can take to improve the situation. I'll also share some remedies that can help some people see some immediate improvement while they're working on the actual underlying mechanism that's making this happen. So I wanted to cover this because over on our video for slow wound healing, Neil asked, hey, I'm a 72-year-old man that has cellulitis in my lower right leg and have very badly infected ulcers in my lower leg where the skin surface is heavily cratered and the infection will not heal even after several antibiotic courses. Can you help me? And we hear from a lot of people that are frustrated like Neil, because this is usually brought about by a bacterial infection in the skin. So then antibiotics are usually the treatment, but when that doesn't work, they don't understand why. Why am I so broken? Why can't I be fixed like everybody else was? But when we look at this study on fungal cellulitis, we need to understand that it's not always a bacterial infection. This study showed that in a lot of cases, it's being misdiagnosed as a bacterial cellulitis when actually what's creating it is some type of yeast or fungal issue. And in that case, antibiotics could actually make the situation worse, because antibiotics will wipe out bacteria, but they don't wipe out yeast and fungal type issues. And this can make it worse because in a lot of cases, these different types of microorganisms will keep each other in check. And when you wipe out all the bacteria, now the yeast or mold or fungal guys are like, this is a party, now we're in charge. And it can make the situation a whole lot worse. So when we want to look at some remedies that can help, one thing that I see a lot of good results with is tea tree oil. And you can just take like a teaspoon of like coconut oil or macadamia oil and then put 4 drops of tea tree oil on there and then apply that topically. We also hear from people that say that, oh, I saw good results by taking a Himalayan salt bath, and that salt can have some healing properties there. As well as some people say, oh, I covered it with manuka oil, wrapped that with like a saran wrap kind of thing, and then put a bandage around that at night and slept with that. Some people will also say internally you can take like oregano oil and garlic, and all of these things are helping because they're antimicrobial. They're helping the body get rid of this invader that's creating a trouble. But I don't really like remedies because I like to fix the actual underlying cause of things. So I'm not telling you not to use antibiotics. Remember, I'm not a doctor. I'm not giving you or Neil any type of medical advice. I'm basically a professional stand-up comic turned nutrition author, because when I lost my voice for 8 years and 23 different doctors couldn't help me, I had to dig for my own answers. So now for 20 years, I've been helping health professionals in more than 40 countries learn how to help their clients fix the actual underlying causes of problems instead of just covering up the symptoms. But in the description below this video, I'll put links to these studies that we talk about so you can dig into this a little bit deeper and help you understand the right questions to ask your doctor. So the first major underlying cause that really can magnify this issue is high blood sugar. And when we look at this study on glycemic control and cellulitis and skin infection problems, they say that when there's a higher blood sugar level, that these people are more susceptible to these infections, and the infections lasting longer and coming back again and again. And if you think about this, why wouldn't this be the case? you're a popsicle. You basically are a party for all these microorganisms that feed on this sugar. So if sugar is abundant in your system and even in your tissues because your body doesn't know what to do with it, can't process the sugar correctly, and it's really becoming a big burden for the body, now you're going to supply a fuel source to all these guys that when they come in and, hey, we're going to wipe you out with this some type of antibiotic or something, they're like, hey, we're having a party. We have too much fuel. We're too powerful. You can't stop us. So if we can take steps to reduce that blood sugar, now we're not supplying a constant fuel source and we can wipe them out. So an easy way to check this out is just to get a glucometer at your local drugstore for $40. And you check your fasting blood sugar first thing in the morning. And if that's over 100, that's a sign that your blood sugar is leaning on that more high side. Now, this is not a diagnostic thing. There can be other factors that can affect where that blood sugar is going to show up. But if you see a reading like 115 first thing in the morning, then you know sugar is probably contributing to this problem for you. And if you take steps to bring that down and fix any insulin resistance type issues, then you can get that sugar under control, which makes it easier for the body to deal with the infection. That's why there's so many studies showing that these types of skin infections and ulcers and all these things, the sores that happen on the legs and feet, are more common with diabetics. All that sugar is kind of pooling down at the bottom of the body and being more abundant there and creating all of these issues. So we have videos on how to fix insulin resistance. We'll put those in the description below, but that can be a really big factor for a lot of people. This study also said that people that were using like anti-inflammatory steroids or things to reduce inflammation are also more inclined to have these type of infections. And why wouldn't you? If you're kind of basically turning off the immune system, then that's going to make it more susceptible for infections to thrive. So we hear a lot about people who are immunocompromised ending up with these cellulitis or other types of skin infection problems more frequently. And that makes sense. We want to help the body wipe this out, which brings us out to the big cause number 2, which is oxygen utilization issues. When we look at this study on hyperbaric oxygen therapy, they showed that that really has the ability to reduce the time that someone will be dealing with these cellulitis or skin infection type issues, because the body needs oxygen to attack these invaders. That's part of that immune response. So when we can increase that oxygen level, like we see in these studies with the oxygen therapy, that helps the body take care of the problem. Here's the problem. A lot of people don't have the ability to get oxygen to the right place. You'll hear a lot about people who are anemic or have low iron levels will be more susceptible to these skin infections, and that's because the body can't carry oxygen where it needs to go. But here's another thing. A lot of people don't understand the Bohr effect, which is something that we all learned about in 8th grade science class, and then we just never talked about it again. But the Bohr effect helps us understand that the pH of the blood needs to stay in a very narrow range. And if it moves a little bit too far on the alkaline or too far on the acidic side, it can create some malfunctions in the body. So when that blood is leaning too alkaline, the Bohr effect says that oxygen can't leave the blood and get down to the tissues where it needs to be. So if we don't have oxygen at that tissue level, then that restricts the immune system from cleaning up that tissue area and taking care of infections in that area because it needs oxygen to really do that. Now, if the blood is leaning too far on the acidic side, now it's more difficult for the body to pick up oxygen and carry it to all the places that it needs to be, especially the extremities that are further away. So what we can do is we can just look at our breath rate, the rate at which we breathe. So just set your timer on your cell phone for like a minute, and then just relax, try to breathe normal, and then count the number of inhales that you take in that 60-second period. Don't count inhale 1, exhale 2, just count the inhales. Now, this is not a diagnostic thing, but this can give us a clue of where that pH is lying for the blood. So if that breath rate is below 12, that's a sign that the blood is leaning a little bit too far on that alkaline side. And if the breath rate is above 18, that can be a sign that the blood is leaning too far on the acidic side. So the body is just adjusting the rate at which we're breathing to help deal with CO2, either hold on to more CO2 or get rid of more CO2 to help us balance out that pH. So I dig into this a lot more in our video on understanding chronic fatigue, and you can dig into that if you think that might be a problem or if you run this test and you see that your breath rate is not between that 13 to 18 range where we really want to see it. And if you can correct this issue, now you help the body get oxygen where it needs to be so the immune system can do its job. This is a huge factor for a lot of people. Another thing we're going to look at is that with type 2 diabetics, we often see a very low breath rate because their blood is often leaning more on that alkaline side since they can't process glucose correctly. So now this person has high blood sugar, they're feeding all these bad guys, and the oxygen can't get down to the tissues. So now they have more than one problem contributing to this thing at once, which makes sense why it would come back again and again. But this study on an oxygen sensing bandage shows that they use this bandage that can sense the level of oxygen at the tissue levels for people with this cellulitis. And they put that bandage around that area and it showed that it had less oxygen than other areas that were not having this infection. So we know that it's important for oxygen to be in the right places so the body can function the way that it's supposed to. Which brings us to the third common underlying cause, which can be tissue calcium displacement. So this doesn't mean a person needs to supplement with calcium. It just means things are going on that pull the calcium out of the tissues and put it in the wrong places. And it was Dr. Mark Anderson that did a lecture called The Triad that helped us understand that when too much calcium is pulled out of the tissues, that restricts the immune system. Now the immune system can't be signaled that there's a problem that needs to be cleaned up. But when you can push the calcium back down to the tissues, now the immune system is told, hey, there's a problem, can you come get rid of this invader? And one thing that can push calcium back down to the tissues is an amino acid called lysine. So when we look at this study on lysine topical creams, they found that that could really speed up the length of time needed to heal these infections. And the reason that is because lysine is helped pushing calcium back down to the tissues to activate that immune system. But a person can also take lysine capsules to help push that calcium back down to the right place. And an interesting thing to think about is the most common thing that will pull calcium out of the tissues is too much sugar. So now again, we're looking at people with high blood sugar or someone who's eating too many carbohydrates and processed junk food. They're pulling all the calcium out and then lysine can help push it back. But the real solution is to reduce the amount of carbs and sugar and junk that you're eating, and then you don't need to use lysine to push that down. If someone's eating piles of junk, lysine is not going to be powerful enough to push enough calcium back down to the tissues. We also need to change what we're shoving into our gullet to keep these problems from really coming about. So one thing you could do at home is you can just look at your urine pH with test strips you pick up like at a health food store or on Amazon. And if your urine pH is higher than 6.1, that's a sign that you're pulling too much calcium out of the tissues and the body is trying to get rid of some of this calcium, and that raises the pH of the urine since that calcium is very alkaline. Now this is not a diagnostic thing as well, and this is not always going to line up because other things can lower the urine pH, but if you look at your urine pH and it's like 6.5, that's a really strong sign that calcium is being displaced and you might need to take some steps to reduce the carbs and sugars that you're bringing in and maybe use some lysine to push that calcium back to the right place. So you can see this can be different factors from person to person. We really have to look at our body and learn to work with our body instead of against it, and then we have a much easier time of actually seeing results. And if you have other things that have helped your cellulitis, be sure to let us know in the comments so other people can see other steps that have worked for other people as well. Now, if you find that your breath rate was too low or too high, jump over right now and check out that video on improving chronic fatigue, and that'll help you understand how to correct that issue so your body can use oxygen and fight these invaders off. I can't wait to hear about your results.